Hi, Sarah. It's great to see you again.
Yeah, you too.
How have you been since we last saw each other?
I've been okay. Kind of same old, same old.
Same home.
Yeah.
Anything noteworthy happened?
Um, I wouldn't say really like noteworthy. Kind of just dealing with the same stuff. Finding it really hard to leave the house and um do things that I used to because I'm just so scared of like panicking and just lots of anxiety lately too.
Yeah, we had talked about some of the anxiety, but then also the fear of inducing that anxiety. That must be
Mhm.
really tiring for you.
Yeah, it is. I've been sleeping a lot, honestly.
Have you? I know that we had talked about your sleeping, and struggling to sleep last time. Do you feel like you've been getting more sleep since we last spoke?
Yeah, but not necessarily at night. I feel like my anxiety almost gets worse at night. Like when I lay down to go to bed, all of my thoughts start circulating and stuff. So it's really hard at night. And so then I just like struggle with like excessive like daytime sleepiness. And I think I don't know, it just like I'll take like multiple naps a day.
Okay, yeah. So you are able to get some napping in though during the day.
Yeah.
Sorry. Do you have any thoughts about why, I mean, other than just like laying down and to go to sleep and your thoughts start to kind of accelerate, do you think that you have any idea about why it might be, you might be more anxious at night?
Um, I mean, the only thing I can really think of is just like a lot of my fear goes back to that first panic attack I had. And since it happened in the middle of the night, I'm worried that I'll wake up and
Right,
it'll happen again.
right. I remember we had talked about that, and I think you had talked a little bit about your changes in appetite being related to that fear of that nauseous feeling that you had.
Yep.
I did want to talk a little bit more about that first anxiety attack that you had while you were on vacation, if that's okay with you.
Yeah.
I know that you said you weren't sure of any particular trigger for that, but I wondered if you remembered some of what your thoughts might have been as you were traveling before
Hmm.
that first night.
Yeah, I would say I was definitely anxious about it. I hadn't traveled in a while or like been away from home, so it was definitely like anxiety inducing. And I was just like struggling um when we were driving down to Florida. I think I had a hard time even just like getting there because I was really worried. I don't really know why. I just like didn't feel like myself and was off and um yeah, so there definitely was a lot of anxiety before. I just hadn't really like had a panic attack before that.
Right. And that is a long drive down to Florida, so that could have been a lot of time for you to have those thoughts and feelings.
Yeah, I was definitely trying to like calm myself down the whole time.
What kind of things were you doing to try to calm yourself down?
Um, I feel like I always just try to like focus on my breathing because that tends to like I start breathing faster and like my heart rate goes up and stuff. So I try to like calm myself down by doing that or like I don't know, distracting myself too. Like I was trying to have like conversations with my friends and stuff so I wasn't thinking too much.
Those are both great strategies, especially I think the breathing and noticing that that's something that was maybe contributing to your anxiety and
Hmm.
trying to work with that. It's good thinking. That's actually something I wanted to talk to you about today, whether you had tried some breathing techniques before.
Yeah, I mean, I don't really know like specific techniques. I just know um I'll try to take like deeper breaths. That seems to help, or like uh I don't know, it's like slowing it down.
Right. Yeah, but you're noticing that that's happening to you as you're getting more anxious.
Yeah.
So you said you talked to your friends a little bit to try to distract yourself. Were you able to talk to them at all about what you were experiencing?
Um, I was like not I didn't talk about it on the way down at all because I felt like that would make it worse talking about it. But when the panic attack happened, I turned to my friend that I'm closest to because I wasn't really sure what to do about it. I don't really feel comfortable talking to the other people, but she seemed like the safest bet, I guess.
And how did that feel when you were able to talk to her about it or let her know what was going on?
It felt good. I um I definitely didn't feel as alone and like I was going to die. But there's just like only so much other people can do for you, and she wasn't really sure what was happening either. So I think it just helped in making me feel like someone was there for me.
All right, maybe just helps having her presence, even if she didn't exactly know what to do.
Yeah.
Um, I wanted to ask you, I know you said that it had been a while since you had traveled or been away from home,
Mhm.
when you went on that trip. Do you know when the last time that you had traveled had been?
Um, Probably I want to say when we dropped my older brother off at college. That was like 2 or 3 years ago. But obviously that was with my whole family, and
Right.
I don't know, I guess I don't really remember feeling as anxious about it then.
So, most of the times that you had traveled before, had that usually been with your family, or had you taken other trips with friends before?
Um, no, I don't think so. I think I've only really traveled with my family.
Okay. And had there been any trip that you had taken where maybe being away from home had caused some fear or anxiety for you in the past?
Um, well, now that I'm thinking about it, I did always have like trouble as a kid being away from home. Like I remember going to like a summer camp and feeling like really sad about being away from my mom at night and wishing she was there.
Okay. So, about what age was that? Do you know?
I want to say I was like 10 maybe.
So, you think that that was stemming from especially being away from your mom?
Yeah, I think it's usually mostly centered around my mom.
Was it a feeling? Can you describe that feeling more? Was it like uncomfortable or fearful?
Um, Kind of both. More so like fearful, I want to say, and I don't know why.
Okay. I think, sometimes kids being away from home when they're young, it can be um, kind of make them nervous. But did you feel that the whole time you were at the camp, do you feel like it changed at all those feelings or stayed the same?
Yeah, I think like like the more nights I was away, the easier it got. Um, it's usually like more so the first day or like the first night that's really hard. Um, but yeah, and like during the day usually too, and when I was doing things at the camp, I don't think I thought about it at all. It was more like at night, I wished I was at home in bed, not in this like weird place that wasn't familiar to me.
Right. Do you think you had those similar thoughts being away from home? on this trip to Florida?
Yeah, it's definitely possible.
I wanted to talk a little bit more about your childhood now that we're on that topic and your relationship with your parents. Do you think that you could come up with about 5 words to describe your relationship with your mom throughout your childhood?
Yeah. I guess I want to say it was like, I don't know what like the particular word for this would be, but like almost two-sided. Like, um, they're like kind of two different versions I got from her a lot, and it depended on whether she was like emotionally available for me. So she was like super loving, and I felt comforted by her, um, and safe too. But when she wasn't as like emotionally available, whether she was like dealing with my siblings or like financial issues or whatever with my dad, um, she was distant. Um, didn't really connect with her at all, or felt like almost isolated and like nobody understood me.
That must have been really hard, especially as a young child, to have all those feelings and maybe not feeling like you knew where to turn
Yeah,
or when you could turn to her.
yeah, it was definitely hard to navigate that.
Yeah, sure. And was that something that do you think you were consciously aware of that at a pretty young age, that you needed to kind of know maybe where she was at to know?
Yeah, I think so. I think I more so would take like trying not to bother her route, unless something was really bad. But for the most part, I would say I kind of stayed away from like talking about any problems with anyone.
With anyone?
Hmm.
So was it that you didn't feel that other people in the family or in your life um, could be a person to turn to, or you weren't sure? What were the thoughts there?
Uh, um, I just feel like they didn't really understand more so. Like, um, and it just like didn't seem like anybody else was having problems like I was, or like, I don't know, I just kind of felt like an outcast in my family almost.
Okay. Yeah, I'm hearing that you felt isolated and not feeling understood, and that can be really difficult for anyone, but especially at such a young age. Um, I wonder if you could tell me, thinking back to that time period, when you were upset, either emotionally or maybe physically hurt, what would you do? What would your strategy be to deal with those thoughts or feelings or
Um, I probably just deal with it myself, honestly. I remember like going to my room and crying a lot. Um, I mean, if I was physically hurt, I'm sure I would have told somebody, but just like thinking of some instances where I did get physically hurt, it didn't really do much. So maybe I like got the message that it wasn't worth it at some point to talk about what I was going through.
when you say they, do you mean your parents?
Yeah, like I think about um I broke my arm when I was in like the 3rd grade, and no one really believed me when I was like telling like my parents that I was in pain. They thought I was exaggerating and stuff, and they didn't take me to the hospital for like a day or two because they didn't think it was as serious as I was making it out to be.
Yeah, I can't imagine what that must have felt like to be in that physical pain and then also maybe emotional pain there, not being.
Yeah.
Do you have any thoughts about why they didn't believe you? Was that a pattern that they had with your siblings, or
Um, I mean, it's possible. I think like my older brothers was pretty anxious as a kid, so he might have like exaggerated things or and my younger sister, she was like physically ill and like actually showing symptoms of being physically ill, whereas like I was just saying I was in pain, so there wasn't really proof, I guess. I don't know.
so you kind of got this message that whether or not you were in physical or emotional pain, it wasn't something maybe important enough, or maybe priority wise, not something that was at the top of the list for people in your family.
Yeah, I think so.
Yeah, I can imagine that that would be very difficult. Um, and did you have friends when you were younger that you could, and like maybe in your neighborhood, or was it usually something where you went, you sat into your room, or
Um, I mean, like when I was a little kid, um, I feel like it didn't bother me as much. It was more so once I got to like high school and I couldn't like get things out of my head, I would turn to friends. Um, but I mean, it just depended on the circumstance too. Um, I don't
what do you
know.
mean by that? It depended on the circumstance.
Like I'm thinking of like if something like happened with like a boy I liked or whatever, I'd turn to my friends about that. But if there was like something that happened to my family or whatever, I don't think I would tell them.
So, do you feel that maybe you were choosing things that you felt were appropriate to talk to other people about?
Yeah, probably.
How do you think that you kind of made that determination?
I don't know. Maybe like seeing how they reacted when I talked about different stuff. I mean, like that's all I can really imagine is um they felt or like they acted weird or uncomfortable if I talked about family stuff, but like when it's like about a boy you like, they can relate to that and understand, and it's more interesting at that age. I don't know.
Yeah, I can see like, how that might happen.
Mm.
Um, so feeling like when you are turning to other people about what you're feeling, though, you're making decisions about based on maybe their reaction to you, what it is that you can talk about.
Yeah, definitely.
And do you think that that affects your feelings about talking about your experiences with anxiety?
Yeah, I would say so.
Yeah, I think that that's a fair adaptation. It sounds like you were adapting to your environment a lot as a child, and maybe if it wasn't conscious, it was subconscious, but making decisions about, who you could talk to and when,
Hmm.
some uncertainty about that with your mom. Um, have you, since you've gotten older, have you had a chance to talk to her at all about your relationship as a child, or has there been any change, do you think, in that relationship?
I think um there's just been more so a change in my perception of it all. I feel like I was angry or like upset about it back then, but now I more so have the understanding that she had a lot to deal with. I had two other siblings, and she couldn't always be there for me when I wanted her to. Um, I wish I hadn't taken it so personally as a kid, but what you gonna do?
So you feel like you have a better understanding of her now that you've gotten older?
Yeah.
Do you think that she has a better understanding of you?
Yeah, I think she still thinks I like keep things to myself and I'm very like um secretive almost, but I think she understands why um and like how I might not have always felt comfortable going to people because I felt like it wasn't important or I would be a burden doing it. So I think she does understand now.
Okay, so has she commented on that? On your tendency to maybe not talk about things as much?
Yeah, I think when I had my first panic attack, she wondered why like I had been keeping like all the anxiety I was feeling to myself for so long and why I hadn't come to her about it. So, yeah, I think it's more so like mental health wise. I like keep those things to myself. I'm more secretive about that.
And with your dad, I know that you had mentioned that maybe you didn't feel always comfortable talking about those things with him either.
Mhm.
Could you think of a few words to describe your relationship with your dad growing up?
Um, I mean, he worked a lot, so I feel like I really only saw him like on Sundays or like in the evening. Um, but like it was always like we would just like have fun, I guess. Never be too serious about anything. Um, I don't know, I just remember playing like sports with him and my brother, watching TV, I don't know, stuff like that, pretty casual.
Okay, so you did a lot of activities together maybe when you did see him,
Yeah.
but maybe less talking.
Yeah, I don't think we ever talked really.
All right. Well, thank you for sharing all of that with me. Um, it helps me to get a better idea of, how you grew up, and I think that's important for anybody. But um, I did have a few questions that I wanted to go over with you that we didn't really get a chance to talk about in our first session. So I just have a short list of those. And if you feel uncomfortable answering any of them, just absolutely let me know and we can just move on, okay?
Okay.
All right. Okay. So have you ever heard any voices or seen anything that might not be there?
I don't think so, no.
No. And have you ever had any self-harming behaviors in the past or current?
Yeah.
Would you feel comfortable telling me a little bit more about that?
Um, yeah, um I don't do it anymore, but I would cut myself as like a teenager.
Um, do you know what might have been your motivation to do that?
Um, how I like to think about it is I was feeling so much pain at the time. Uh, it was the only way to like distract myself from it was like having physical pain, and it almost kind of like felt like a release, like I was letting out all the distress inside of me.
Yeah, I think that's often how people feel about pain sometimes is that physical pain is maybe easier to deal with than emotional, something that's inside of us. It's, maybe you can't just pinpoint an exact spot on your body that hurts as you can usually with physical pain.
Yeah.
And you said that's not something that you do anymore.
No, I know that's not good or the right coping mechanism, so I don't do that anymore.
Coping mechanisms, they people say good and bad, and sometimes it's just what serves you at that moment. But were you able to discuss that with anyone when that was happening or when you made the decision to stop?
Well, it was my friends who saw it, so um I kind of felt embarrassed about it too. Uh didn't really want to like worry anybody about me, so um I tried to like do something else instead of that.
Okay, so people noticing felt some embarrassment and not wanting to have them be concerned about you,
Mm-hmm.
that motivated you to try something else.
Yeah.
Okay, and what did you try instead?
Um, I try like breathing through it or like um going on like a walk. Um, sometimes like really cold water helps too, like running that on my hands and wrists. But yeah.
Yeah, it sounds like you came up with a few different things that could help you there.
Mm-hmm.
If that's ever anything that you want to talk more about or something that you have any thoughts about, just let me know and talk about that here.
Okay.
Thank you for sharing that.
Mm-hmm.
Um, what about any kind of chronic pain or chronic medical conditions?
Um, no, I don't think I have that.
And I know I think that you had said you're not currently on any medications. Is that correct?
Yeah.
Have you been on in the past any that were like long term?
No.
And I know you said you hadn't been in therapy before, but have you ever had any mental health treatment or inpatient stays or anything like that?
Um, I did in high school once. My friends told my mom about the my cutting and stuff, and um they were all scared I was kind of suicidal or something. So I did do like an inpatient program for a week or so.
So your friends told your mom about that when they found out.
Hmm.
Um, how did that conversation go with your mom? She
I
found
think I think she was upset that I kept it from her and a little hurt, but she went and looked for some help and I got it. So
Did you feel like that helped you, the inpatient stay?
um kinda, I was mostly just like set on getting out of there. So I feel like I was just saying or doing whatever I had to do and
Right.
not really focused on helping myself.
Okay. So, maybe because it wasn't your idea to go, you were just kind of looking to get through it.
Yeah.
Um, well, thank you for letting me know about that as well. I had a few more questions here.
Hmm.
I wonder if you have any kind of cultural or ethnic identities or beliefs that are important to you that you think I might need to know about or that you'd like to talk about in our sessions.
Um, not really. Um, I mean, the only thing I could think of is like that I was raised in Catholic school, but I'm not like really religious or anything. My family was back then, but um I don't know. I went to like a public high school and stuff, so we've kind of like drifted away from that.
Okay, so the whole family has kind of drifted away from that.
I mean, not my grandparents or anything, but I would say like my immediate family, yeah.
Okay. That was my next question actually, was whether you had any spiritual or religious beliefs that were important to you.
Yeah, not really anymore.
Was that something that was important to you as a child?
I mean, they definitely like make it hard not to believe in God when you go to Catholic school. So yeah, I prayed and stuff and believed in Jesus and all that, but I don't anymore.
When you were younger and in Catholic school, what type of relationship do you feel like you had with that religion or with God or Jesus?
I felt kind of, I mean, looking back on it, I didn't think of it at the time, but like looking back, it was definitely like a fearful and controlling relationship. Like I was always worried that I would do something wrong, or if I did mess up, like I really beat myself up for it. And there's just like a lot of shame, I would say.
Some shame and maybe pressure from feeling like you were maybe always being watched and needed to kind of perform or behave in a certain way.
Oh yeah.
And when did you think that you stopped believing?
Um Probably, I don't know. I like started questioning it pretty young, but it wasn't really until like I was probably like 13 or 14 when I went to public school and um, started meeting like gay people and stuff like that. I was just like, I don't know, just all the teachings kind of became screwed up, and I didn't like the idea of how much they shamed people, and I don't know, just all of it just didn't make sense anymore.
So maybe as you started to learn about the world or different things, you felt like it didn't, your beliefs didn't really coalesce with that.
Yeah, exactly.
Do you feel like that caused any rift in your life or your relationships with others, or impacted you in any kind of negative way?
Um, it's hard to say. Um, I guess it's possible. I felt a little more alone, um, because I did like pray to God every night and stuff when I was a kid, but it just seemed stupid when I got older. I didn't think anyone was really listening anymore. And I don't know. I mean, definitely won't talk to my grandparents about religion because that'll just start some sort of argument. But I would say that's like the only really negative impacts.
So maybe that loss of prayer felt like a loss of relationship for you.
Yeah. And kind of like a lie too, almost like everything I'd been taught wasn't true.
Yeah, I can see how that would kind of be a lot to navigate at that age, especially.
Yeah.
Yeah, just a couple more questions here. I wonder if there's anything about your gender identity or your sexuality that you'd like me to know.
No, not really. I'm straight. I identify with she, her pronouns.
If you'd ever like to talk any more about that, just let me know. Just want you to know that this is a safe space to talk about anything that you'd like.
Okay.
And then just one last question here. Have you ever had any legal troubles? No? Okay. All right. Yeah, that was just a few things that I think we hadn't really gotten to in the first session that I thought might be important to go over. So thank you for going through those with me.
Yeah.
Um, I want to go back to your childhood, maybe, and your relationships and your family.
Mm-hmm.
Can you think of a time where maybe you felt particularly rejected an instance of that happening?
Um, hmm. I guess, I don't know, I'm trying to think. I mean, there's definitely some drama in like middle school with friends. Um, I feel like, I mean, like Catholic school is so small. If you weren't like other people there, you're kind of an outcast, and that's definitely how I felt there too. Um, Not necessarily rejected. I like did have friends, but I guess I couldn't really be myself around them. Like I had to put up a front, which I don't know. I guess I feared rejection almost.
Yeah, I think that's got to be really hard. It sounds like maybe there was some feelings at both at home and in school, maybe that you couldn't be your whole self, or that
Mhm.
you had to kind of pick and choose what parts of yourself that you showed. Is that fair
Yeah.
to say?
Yep.
Um, and then I know that you mentioned like with your breaking your arm in the third grade, but was there ever any time that someone else physically harmed you or emotionally harmed you intentionally?
Um, I mean, like I got into some fights with my older brother. Uh, and like obviously he's older than me, so I for sure got hurt, but I wouldn't say he ever beat me up past like age 10 or anything. Um, yeah, that's all I can think of.
Um, when that would happen, would you feel that you could go to your parents or get away from him in some way, or
Um, yeah, I think so. I think it was more understandable if I like went to them and said he had been like beating me up or like he hurt me, because he's the older brother, he shouldn't do that.
right? Okay. And I see that you have a little puppy right behind you.
Mhm.
Um, have you had pets throughout your childhood as well, or
Uh, we had like cats and we had one other dog before him, but uh yeah, I would say I mostly grew up with cats.
cats? Okay.
Mhm.
And do you feel like you kind of a pet person, or do you spend a lot of time with the cats and dogs growing up?
Yes, I love
Yeah,
animals.
right. So is that something that you feel has been able to help you at all with your anxiety?
Oh
Stuff?
yeah.
Yeah,
I mean, like it's obviously doesn't take the place of a person, but just like having an animal next to you, when you feel like alone or an outcast is an amazing thing.
yeah,
Having something love you.
right.
Mhm.
Yeah, I think that I'm hearing that a lot, feelings of isolation and maybe wanting a connection that you haven't been able to find sometimes.
Yeah.
But it does help to have animals. I can agree with that.
Yes, definitely.
Well, I wanted to talk a little bit about your goals um, in these sessions and kind of what you'd like to see happen in your life.
Mhm.
Um, I think, obviously reduction of the anxiety is something that we've talked about.
Yeah.
Um, what would that look like in your life, do you think?
Um, Maybe like stop being so scared of the future. Um, Kind of uh stopping like the overthinking and like obsessing over things that like I can't control. And like also just reading too deeply into other people's perceptions of me. Like not just like I wish I just didn't care so much.
Okay, yeah, I think those are all good goals or things to think about. I wonder if whether worrying about other people's perceptions of you, whether that's been in the past something that served you well, maybe being able to read other people's reactions to know when it might be a safe time for you to talk about certain things or not.
Yeah,
So,
yeah, definitely.
so that's something that maybe you've been doing for a while now, kind of a hyper awareness of other people's thoughts and feelings.
Yeah, I definitely feel hyper aware of everything.
So I wonder if we can think through maybe some concrete goals that we can revisit in a future session to see if there's been any improvement
Hmm.
for you. I know that we had talked about the frequency of how often you're having the anxiety, and you said that was like a daily thing for you.
Yeah.
And would you say it's mostly throughout the whole day, or in the daytime it's a little bit better than at nighttime?
Yeah. Yeah, it definitely gets worse at night. It's also kind of like not initially when I wake up, but once I realize where I am and what's happening, like maybe an hour after I wake up, it's really bad then too. But calms down during the day and then sparks back up at night.
So I wonder if maybe one of the goals could be to try to um, manage that anxiety so that maybe it's not every night of the week, maybe, you know, a couple nights of the week you're able to sleep mostly through the night. Would
Yeah,
that be
that'd be nice.
something?
I would love that.
Yeah. And then I know that you said that the anxiety was kind of affecting your ability to go out or go to work or socialize.
Hmm.
Is that something that you'd like to work on, a goal for that?
Yeah, I hate being homebound. I mean, like, I'm definitely like a homebody, but I like to be out and travel and do things. So it really sucks that I'm scared to now.
Yeah, maybe you don't want to feel trapped. You want the option to go when you want to go out.
Yeah.
So maybe another goal we could think about is trying to go out once a week. Maybe go for a walk to the park or go get an ice cream, whatever it is that you like to do.
Yeah, I could consider that. Kind of sounds scary though.
Yeah, well, this is something maybe we can work toward. I'm not saying by any means this is something you need to go out and do on your own, in the next week or anything like that. Just want to kind of get a sense of some more concrete goals so we can know, if maybe some of the things that we're talking about are strategies that we consider are helping you.
Yeah.
So that's
Okay. Mm-hmm.
um, and then in terms of returning to work, is that something that you maybe want to focus on down the road or something you want to start thinking about now?
I mean, it gives me a lot of anxiety to think about, but I need to go back to work. So I'm not really sure how to manage that.
Okay, so do you want to set a goal of maybe how many days a week that you'd like to try to return to work starting off, or
Um,
maybe just
yeah, I could think about that.
starting with one shift or
Yeah.
and when do you think you'd like to maybe return to this conversation and see where you're at for different goals?
What do you mean?
Um, I don't want it to be like this is something you need to do in the next week, but I want us to kind of maybe return to these goals and see if there's been any progress. So I'm wondering if there's a time period that you think would be appropriate, maybe a month, 2 months, however long you think you'd like to
Um,
see.
I feel like a month is probably good.
Okay, all right, so maybe in a month we'll talk about these again and see where you're at.
Yeah.
And then the other thing I did want to talk about is um, I know that you'd mentioned some strategies that you've had to try to deal with the anxiety, one being the breathing and um, maybe the cold water and walking. Was that something that helps with the anxiety sometimes too? Or yeah,
Yeah, it's like when it gets really bad and I need something to calm me down instantly.
and does that seem to usually do that for you
Yeah. Sometimes.
sometimes?
Yeah.
All right. I wonder if you'd be willing to, if I emailed you some different breathing techniques, if you'd be willing to look those over and see if you might like to try some of them. See if
Yeah, I'd like that.
okay, yeah, definitely. I'll send you a few different techniques. That is something that a lot of times people find helps with anxiety. And I know that taking deep breaths is important, and that's a good way to try to deal with that. But there are some specific techniques that sometimes help people more than others. So maybe that's something you could try out in the next week. And when we see each other again, we could talk about whether or not those helped, or maybe hopefully it didn't make them worse, but
Mhm.
they're effective at all.
Yeah, that sounds good.
Okay, great. One other thing I wanted to talk about quickly was meditation. Have you ever tried any types of mindfulness meditation or anything like that in the past?
Um, Meditation, I feel like we did at school once, but I haven't really tried it in depth, especially just because I think so much where it's like I don't know how I could possibly meditate.
Yeah, I think oftentimes that's what I hear people say. But the way I like to think about it is the meditation is in kind of noticing when your thoughts stray, not to expect that they won't, because I think that's a natural part, of the way that the mind works. If that's not something that you feel would help you or you feel maybe comfortable trying right now, that's completely fine. Just something I want to kind of put on the table and to think about, because that's another thing that people with anxiety oftentimes find that can help them a bit. So
Okay.
we could talk about that more in another session if you'd rather wait and see if the breathing
Yeah.
techniques. Okay.
Mm-hmm.
So, was there anything else that you wanted to talk about now?
No, I don't think so.
And how did you feel that our conversation went today?
I think it went well.
How was your anxiety level as we were talking?
Um, I don't know. I'm a little like agitated and restless, but that's kind of the usual. So it wasn't any worse.
So it wasn't worse than it normally is.
Mhm.
Wow, it looks like your puppy is getting up and moving around a bit. Might want some of your attention.
Yeah, probably.
All right. Well, if it's okay with you, I'd love to see you again same time next week and talk about maybe how those breathing exercises might have worked for you.
Yeah, that sounds good.
Okay, I'll send those to you right now and we'll talk about it next week.
All right, awesome.
Okay, have a great weekend.
All right, thanks, you too.